Hello everyone, it's Michael here at HomeHealthSuccessAcademy.com and 10xPatientReferrals.com, and welcome to our How to Start a Home Care Agency. In this video series, we're primarily going to be talking about how to be able to start your own private duty, non-medical home care agency. Okay, and then we're going to be able to help you differentiate between what is a medical home health agency and a non-medical home care company. So why are we doing this video series? The reason for that is we're getting a lot of people asking us how to be able to start their own home care company. And I myself has owned my own agencies, both medical and non-medical, and I've helped multiple people start their own home care, either medical or non-medical agencies. And what we want to do is we want to be able to provide you an online platform, an online learning to be able to get all the information you need to be able to start your own home care company. So in this video series, we're going to talk about the overview. What is the industry about? What are the services? And then we'll move on to module 2, which is, what are the preliminary considerations you need to be able to make when you are about to start or thinking about starting a home care company. How to be able to create a feasibility study is module 3. So that you can actually kind of figure out where you should concentrate your business. And then moving on to module 4, which is the business plan. Module 5 is how to finance your own business. Where do you get the funds? How much money do you need to start an agency? And you'll be surprised that you're not going to be spending $30,000, $40,000 out there to be able to start your own company out there. But then we're also going to talk about, should you go to the franchise route? Or should you partner up with somebody? Or should you just bootstrap and start your own agency by yourself? Module 6, we're going to talk about the business startup requirements. Module 7, we're going to dive into a little bit of marketing. Module 8, how to be able to learn how to do relationship selling. Module 9 is about home care service menu. What are the services that you should be offering? In Module 10, we're going to talk about the roles of the home care assistant. Module 11 is preparation activities. What are you going to do to get yourself ready out there to market your company? Module 12 is the service delivery process, and Module 13 is client services. And one of the most important part about running a home health agency, a home care company, is Module 14 is what to do on the day-to-day operations of your organizations. So, one thing that you should understand is this, right? Right now is the great opportunity to be able to start your own home care company. If you have ever considered starting and operating a home care business, conditions have never been better for success. Now, who should start a home care company? You can be either a nurse, a physician, you can be an LPN, either an LPN or an RN, you can be a nursing assistant or even a caregiver right now. Or you can actually start an agency without any background in the healthcare industry. As long as you're willing to provide great care and provide services to the senior community, this business is for you, okay? The senior population is one of the fastest growing segments, and consequently, the demand for non-medical home care services is greatly expanding and will continue to expand well into the 21st century. So what this means is that there is a business opportunity in the home care industry that is open to you right now. Yet, the task of turning this opportunity into a reality remains as challenging as ever. There's competition. Yes, that is true. The competition in the home care field is stiff, can be hard, but it's how you position yourself and how you ready yourself is what's going to make the difference. So this training process that we're giving you guys will give you everything that you need to know to be able to run your agency. But I want to tell you guys one thing, and that is that some states may be different than others out there. And so we're also going to be giving you guys links to whichever state you're planning to open up your company to be able to know certain things. There's some states that requires you to have actually a license to run a home care company. And there are some states where you don't need to have a state license. All you need is a business license to start the agency that you want. And so it's still good to be able to go to your individual state requirements and figure those out as well. But if you want to be able to talk to one of our service clientele people at our facility, we definitely want to be able to help you guys out. So let's go ahead and get started. So like I said, module 1 is about pretty much the overview. So that you can actually figure out, what is home care? What is home health actually about? So home care can mean different things to different people. So having a common understanding is an important first step in the planning and development of your home care business. Home care is a general term used to reflect a wide range of social, medical, and non-medical support services that are conducted for the purposes of enabling compromised individuals to live safely and independently in their own home and their communities. So when we talk about communities, these are your apartment complexes that are meant only for senior citizens. These are those home communities, these gated communities where they only require people to have a minimum of 55 years of age to be able to live in those facilities. It could be assisted living communities. It could be senior housings, right? So it's not just taking care of people at their own home, it's also taking care of people in the communities that they live in. Home care services are provided by a number of different types of home care organizations or even agencies. And the skills, the duties performed by these home care personnel can vary as well. Home care that is not paid for by the government, such as, for example, Medicare or Medicaid, is what we call private duty home care. Private duty home care agencies may provide highly skilled nursing services and or non-medical support services. Private duty home care services are usually paid for by the client and is in some cases by third-party payers, as we further on explain later on into this series. So that's what we want to be able to share with you guys. So is there really a need for home care? The truth is this, there is definitely a need for home care services, and that need is escalating and will become a factor to reckon with as the elderly population, continuously to increase. So part of this upsurge, or this uptick of the senior communities the growing population, is that senior citizens are living longer and baby boomers are swiftly approaching their retirement years. The development of healthcare teams and healthcare providers enable people to be managed and monitored in their own homes and communities. Because of the high cost of healthcare in hospitals, patients are being discharged early. Patients are also being discharged early because a lot of insurances are only covering them to a certain area of coverage. So many patients may require short-term assistance at their home. Care in the home is more cost-effective than care in the hospitals and institutions. The quality of life improves for who are able to remain in their own home. So the burden on caregivers, whether it's the family and or friends who are providing direct care to that particular person, is beginning to increase. Often, this can result in caregiver burnout, which in turn leads to the need for outside support. There are global changes in healthcare needs as a result of non-communicable diseases as well, mental illness, injuries, and even the continual growth of HIV and AIDS. Research is increasing the availability and effectiveness of treatments, medications, and technology, which makes it possible for people to be cared for at home rather than being cared for in hospitals as well as institutions. These issues continue to place an increasing demand on the need for long-term care. Since healthcare costs will become even more staggering, the provision of effective in-home care continues to become a strong option. So what are the goals of home care? The goals of home care include assisting individuals to improve and maintain their health and quality of life, promoting the individual's independence, enabling individuals to receive care in their own home, enabling individuals to leave a facility to receive rehabilitation or even palliative care at their house. It also includes providing support to the family, which will help them handle an individual's need for care, providing informal caregivers with support to meet their own related needs. Let's go ahead and talk about what are the advantages and disadvantages of home care. Like, why should someone have these services? Let's go with the advantages. The advantages would be that clients are happier when they are able to remain in their own home, in their communities, as they can maintain their independence. When you ask a lot of elderly people that ends up in a rehab facility or needing help, one day they're providing care for themselves, and then all of a sudden they get sick, they fall, something happens, and then all of a sudden they're going to be needing somebody to support them. And that can be hard on someone. But being able to stay at their house, in their own home, gives them a sense of priority, a sense of happiness, because at least they're being serviced at their own house. A lot of government subsidization costs are a mere fraction of what they would be if clients were hospitalized or institutionalized. Clients can choose the amount of care they receive hospital stays, right? Hospital stays can be shortened if the level of care they require can be delivered at home, which at the same time lowers the cost of their services. The quality of care provided at home is often better than the care provided in institutions and hospitals. Terminally ill people can elect to spend their last days in their own homes. Relief can be provided to caregivers as well. Now, there are disadvantages, right? The clients may have a number of caregivers, especially when an agency is utilized. Is that a disadvantage, really? I mean, if somebody ends up in a institution or a rehab facility, there's a change of staff every day, every 8 hours or every 12 hours. Sometimes you're not going to get the same caregiver, the same nursing assistant, because they get assigned to a different section. But if you're being provided care at your house, yes, a person is not going to work 24/7 for you, because any individual also needs some breaks. Now, often there is a long-term expense required for in-home care, especially when clients are not eligible for funding or even assistance. So that's a disadvantage right there. In addition to the cost of care, home maintenance and living expenses still must be met. Many people, especially pensioners, simply do not have sufficient financial resources for such extras. Staying at home can sometimes be lonely. Consequently, social activities are often limited as well. And so sometimes there are people who decide to go into assisted living communities or senior living communities because at least they're among their peers. So what are the differences between a medical and a non-medical personnel? Medical home health services are delivered by medical personnel, which includes your RNs, the registered nurses, LPNs, which is the licensed practical nurses. For some states like California and Texas, they're called LVNs, licensed vocational nurses. Then there's the occupational therapists, the physiotherapists, the speech therapists, social assistants, and even dietitians. So these are your medical personnel. Now, when we talk about non-medical personnel, these are your CNAs or nursing assistants or home health aides, non-certified assistants, homemakers, home companions, or even chore persons as well. So who are going to be the people that actually purchases home care services? Well, home care services are purchased by a wide range of individuals and organizations as well, right? These are your elderly. These are your housebound people, the disabled, those with chronic illnesses, those with terminal illnesses, those who are recovering from acute illness for surgeries, those who are mentally or emotionally handicapped, family caregivers, accident victims as well, those requiring guidance with life skills, those seeking assistance with outdoor maintenance, those requiring transportation and errand running, and those who require social change. Let's talk about home health agencies, okay? So, what is a home health agency? A home health agency is a provider of services, which include nursing services, okay? So that has your nursing services, your home health aides, and at least one other home care service such as medical social services and therapy such as physical, occupational, or speech therapy. It coordinates and provides healthcare services to individuals in their homes rather than in an institution setting. To be eligible for reimbursement from Medicare and Medicaid, these agencies need to be certified. Certification confirms that an agency has met the guidelines and criteria established by the federal government for patient care and management. These agencies must apply through the Centers for Medicare and Medicaid Services, also known as CMS. Home health agencies are appropriate for clients who require skilled assistance. Care plans are closely scrutinized and managed and requires a physician order. If a client requires care from more than one type of service providers, a multidisciplinary team often will be assembled to assess and develop simple and comprehensive care plans tailored to meet the individual's needs. The types of services that home health agencies might deliver include nursing, physiotherapy, occupational therapy, speech therapy, medical supplies, social work, home health assistants, and nutritionists or dietitians. These types of agencies may also provide medical services as well. Non-medical home care agency or private duties, let's go ahead and talk about them. A private duty home care agency is generally an agency that provides home care services that are not reimbursable under Medicare or Medicaid. This type of agency may provide skilled nursing skills or what is termed non-medical custodial care, or care that can be provided by a non-medical professional. The types of services available are wide-ranged and can be provided by non-professional personnel and include activities such as personal care, respite care, housekeeping, meal preparation, laundry, shopping, companionship, errand running, and also transportation. The care is usually paid for by privately people, by the client, or in some cases by private insurances or other third-party payers, as we discuss further. A physician's order is not mandatory to receive care, and the type of care is determined by the client and the agency. These agencies may or may not be licensed or regulated, depending on each state's requirements and legislations. So most of these agencies hire the staff, conduct the background checks, administer payroll and taxes, and provide supervision. So like I said early on, that when you're going to be starting your agency, you have to understand that each state is different. There might be a few more applications or a few more forms you might have to fill out if your state that you're trying to apply for requires to have some form of licensing or certification by the state. So who pays for home care services really? Let's talk about that. Service providers may be funded by the federal government, state government, local cities, and private and nonprofit organizations. Most people are not aware that an aging network exists throughout the United States. Most states require that home care agencies be licensed to assure that care is provided within health and safety standards. Each state can establish its own licensing criteria and regulations. Consequently, the requirements will often vary depending on the state. The exception is that agencies which have been certified by Medicare must conform to the federal regulations. Home care services can be obtained from various sources. Clients or their families can purchase service directly from the service provider, or they can purchase services from an assessment of public and private sources. Usually, care is provided whether or not the client and or their families have the required finances to purchase the care. So funding payers include self-funding or private source payers, public third-party payers such as the Older American Acts, the Veterans Administration, social service block grant programs, community organizations, and religious associations. There's the private third-party payers such as commercial health insurances, Medigap, long-term care insurance, health insurance and managed care organizations. You have CHAMPUS, which is the Civilian Health and Medical Program of the Uniformed Services. Then you have health maintenance organizations such as HMOs. You have automobile insurance companies, workers' compensation, and also you have your disease condition focused organizations such as local chapters of the American Cancer Society, the Alzheimer Association, the National Easter Seal Society. Then you may also have limited government payers such as Medicare, Medicaid, or the Medicaid waiver. So what is Medicare really? Let's talk about Medicare. Medicare is one of the primary public payers out there. It's one of the, and so what Medicare really does is that, it is available to retired individuals who are over 65 and who have worked for at least 10 years in a position which contributed to Medicare. To qualify for Medicare, there are 4 main conditions that a person must be able to meet, right? The home healthcare agency must be certified by Medicare. The client must be pretty well confined to his or her home, with the exception of going out for medical appointments or for religious purposes. The client must require nursing, physiotherapist, or speech pathology services at least on an intermittent basis. The services qualified people may obtain from Medicare will include skilled nursing services on an intermittent basis, home health aid services on an intermittent or part-time basis, physical therapy as long as it is medically required, speech-language therapy designed to restore speech, occupational therapy as long as it is medically necessary, medical social services to assess any social factors out there, medical supplies such as wound dressings, and some types of medical equipment such as walkers, wheelchairs, oxygen. Understand that Medicare will pay 80% of the approved amount while the client has to pay the other 20%. Now, Medicare at the same time will not cover 24-hour in-home care services. They will not cover prescription drugs, meals delivered to the home, homemaker services such as shopping, cleaning, and laundry, except that some home health aides will do a few chores when they are in the home for covered services, and personal care provided by home health aides such as bathing, toileting, dressing, unless the patient is also getting skilled care such as nursing or therapy, and the personal care is required because of the illness or injury. So, for example, if a personal care is the only care needed, Medicare is not going to cover the cost for those services. Let's move on to Medicaid. Medicaid is a joint federal and state assistance program that helps with the medical costs of some people with low income and also limited resources who do not have the money or insurance to pay for health care. To qualify for Medicaid, the applicant must have a low income and a few savings or other assets. Medicaid coverage varies from state to state. Each state sets its own guidelines, subject to federal rules and regulations. Certain services must be covered by the states in order to receive federal funds. Other services are optional and are elected by the state itself. In all states, Medicaid pays for basic home health care and medical equipment. It may pay for homemakers, personal care, and other services that are not covered by Medicare. Medicaid has programs that pay some or all of Medicare's premiums and may also pay Medicare deductibles and co-insurances for certain people who are entitled to Medicare and have low income. To determine if Medicaid covers any home care services in the state wherein your business is established, you should actually contact the State Department of Health. So before moving on, let's talk about the Medicaid waiver. Medicaid waiver funds are federal and or state joint programs. The purpose of the Medicaid waiver is to enable individuals who require long-term care services to remain in a community setting, even though their advanced age or disability would warrant placement in a long-term care facility. The waiver allows services that are typically covered by Medicaid only in a nursing facility to be provided to eligible persons in their own homes or in assisted living facilities. So that pretty much right there is Module 1. What we covered here in Module 1 is pretty much the basics of an overview of what the home care industry is about, how to be able to differentiate the difference between, medical home care as well as non-medical. And so I hope this portion was able to help you guys out. Like I said, we covered what is home care. What's the difference between the non-medical and medical? We showed you guys that there is a need for home care services. We want to be able to explain to you what are the goals of providing care at home. What are the advantages and the disadvantages for a client or a patient to have home care at home? To be able to, find out who purchases these services. So I hope you were able to get a brush up on what the home care industry is about. So we want to be able to provide this information to you guys because we want to be able to help you guys learn how to be able to start your home care company, how to be able to then take that knowledge and provide great service to your clients. So we hope that this video helped you guys out. Please make sure that you continue on with your education and learn more about how to start a home care company. Also, always understand that we have 10xpatientreferrals.com, which is our online learning platform, which provides you guys tremendous information on how to be able to learn how to fully market your company out there. Hey everyone, it's Michael here at Home Health Success Academy, and I just want to say thank you for joining us on this quick video. My intentions for today is to be able to get you guys to start using our online marketing university. The intention here is to be able to have you guys make sense of why joining our online learning platform is what's going to be able to create success for your agency, okay? And we want to be able to give you all information that you need to create success. A lot of agencies nowadays are having problems how to be able to get more referral sources, how to be able to get their current referral sources to give them more patients, how to go after past referral source that you lost to another agency, how to be able to increase your revenue, right? A lot of agencies are closing down nowadays, and our intention is to be able to give you all the knowledge that we share with clients of ours that pays us thousands of dollars to be able to manage their marketing team in their agency. So we're reaching out to home health agencies. These are the skilled nursing agencies, right? That bills Medicare and insurances and Medicaid. Then we also want to reach out to the non-medical, the caregiving and homemaker agencies, and especially hospice agencies as well. And we definitely want to be able to have owners, administrators, especially marketers and liaisons for companies to be able to take this online program, an online platform that's going to give you everything, all the knowledge you need to be able to create success in marketing your company. Remember, marketing your agency, selling your services is 100% of your revenue and is in charge of pretty much paying your salary, paying your employee salary, paying your co-worker's salary. This is what we have in our online university. We're showing you how to be able to create your target market, how to be able to look out into the area that you're in, figure out who are the right targets you need to be able to hit, who are the ones you should be visiting, who should you be following up with. We're going to show you how to create a sales process. If you are a company that does not have a sales process, that does not understand a business cycle, this video is important for you, right? When you guys admit patients in your company, you guys have an admission process, right? And if somebody skips something, if somebody shortcuts something, things may fall through. Same exact thing when you're marketing your company. You can't just go out there and think things are going to happen naturally. Okay, so we're going to show you how to do the sales process, how to do your presentation properly. What are the mistakes that you're going to be facing, right? Because we all make mistakes, but guess what? We've made mistakes ourselves, right? For me, for example, I made a lot of mistakes in marketing, but I figured out how to be able to handle that so that I don't do it again. Or if it does come up, how can I actually solve it faster? How to handle objections. You guys heard it all. We don't have time to meet with you. We are already working with another agency. Oh, you know what? I don't have any patients that needs home health yet. You know for a fact that that doctor just took care of another patient that had home health services. How to be able to learn how to get into the front of the nursing homes, into the hospital's preferred provider list, the do's and don'ts of marketing. You know, how to be able to find out different marketing strategies. What should I be giving out to people? Should I have lunch and learns? Should I not have lunch and learns? How much should I spend in a marketing target? Cold calling scripts. A lot of us don't even want to cold call. People are saying cold calling is dead. The reason why people say don't make cold calls because they themselves have quit on making cold calls because they themselves have faced so many objections. But guess what? If you are able to create an appointment, you have a 70% chance of getting that business than walking in cold by yourself live, okay? So you guys have to understand, how do I handle a cold call? That's very much important. All these different series is available individually if you want to purchase them. If you want to purchase just the follow-up techniques, which we will show you guys a follow-up technique on how to be able to increase it, right? We're going to show you guys day 1, day 2, day 3, day 4, day 5, every single thing you need to do to be able to increase that potential referral source to refer patients to you guys. You can purchase that particular series by itself, that for $199, or we're going to share with you guys our membership platform, okay? So let's go ahead and talk about that, right? So like I said, you're going to have access to each one of these courses. You're going to be able to purchase these individually, but if you join our online marketing university, which we have a membership program that we're going to share with you guys in a few, okay? So that's what we do at 10xpatientreferrals.com. This is the particular website right here, okay? When you go into that website, you're going to see 3 memberships, okay? 3 memberships. We have our platinum, our silver, and our gold membership, okay? And so right now, as we speak, okay, right now as we speak, we talked about our online, our boot camp that's coming up all over, right? So guess what? By the end of 2018, we're going to remove a special thing that we're doing, okay? And so what we're doing is right here, right now. The Platinum membership. You get full access on all the courses. If you purchase them individually, it's over $7,500 in value, okay? Just let you guys know, when you purchase a particular series, you only have access to that for a whole month, okay? So if you want access to this every month so that you can keep on going back and learning, right? You would be paying $7,500 a month by just accessing those. But guess what? For a platinum series, it's $149 a month. You have access to all of that. Plus, you get part of our quarterly mastermind meetings. That's a $3,000 value. And you also have access to us for 1 hour a month for coaching. Okay, that's a $2,500 value. And at the same time, as we talked about our boot camp that we're having, you'll get 1 free ticket to any one of the boot camps that we're having. So separately, it's about $9,500 worth of value, and you can access that for $149 a month. Now, things go down a little bit if you just want to do our silver membership. What's going to happen is you get the full access and you get a 1 ticket to our boot camp event. But just to let you guys know, we are going to be taking out that boot camp ticket soon once 2019 hits. So if you want to sign up right now to get that free ticket, okay? So right there alone, we suggest that to you guys. That's $79 a month. Now, if you want something in the middle, which most of our clients are using, it's just our gold membership. You get full access to the whole courses. You get 1 ticket to live boot camp, and you get the quarterly mastermind meeting available as well. So right there alone, we have so much information that we want to be able to give to you guys, and we want you guys to be able to access that right now. So you guys should definitely join Like I said, I want you guys to be able to join this because this is what's going to create success. A lot of you guys are saying, hey, well, $149, that's a lot of money, Michael. I totally understand that. But guess what, guys? Let me ask this question for you guys. If I can show you, and with the techniques I give you guys, and you guys just get one patient by learning the tips, tricks, and techniques, one patient in a whole year, if you are a skilled nursing home health agency, how much is one patient? That's about $3,000 to $4,000 that you're going to get as from Medicare, from the insurances, depending on the billing. Right there alone, it already paid for this particular item. But our goal is not to get you one patient. Our goal is to be able to double your referral sources, to increase it, to increase your patient census. That's what our main goal here for you guys is, to be able to learn how to be able to handle gatekeepers, how to get the appointments, how to present correctly, how to get physicians to start referring patients to you, to get these social workers to start using your agency. Once again, this is Michael with Home Health Success Academy. You have to understand, agencies are having problems getting more referrals. A lot of larger agencies are expanding, opening up their own non-medical, adding hospice to them. So this is a cutthroat industry we're in right now, and then the person that actually educates themselves and learns how to succeed is our one that's going to be able to succeed and beat the other competitions. And if you don't join this, guess what? Your competition is joining this. If you don't attend the boot camp, guess what? People around your area is going to be attending the boot camps that we're having. So like, for example, our event that's coming up in Lakeland, Florida, we actually have people coming in from Georgia, coming in from Tennessee. We have one person that signed up that's coming from, North Carolina. So what we're trying to do is we're trying to create these events to be able to create success for you guys. So make sure you guys sign up, whether you're an online learning platform or attending our boot camp, either or, you should take this. This is amazing information that you guys should actually have your company. If you have any questions, contact us, 630-340-8990. Email us, info@homehealthsuccessacademy.com. But all the information is in our website, homehealthsuccessacademy.com. Our online learning platform is 10xpatientreferrals.com. If you have any questions, always know that home health is easy. Home health marketing is easy when you guys know what you're doing. This is Michael Echeverria. I look forward to seeing you guys in the boot camp, and I look forward to talking to you guys in the phone. Have a great day.